Hello, my name is Lorena Garza. I'm from Mexico City. Currently, I'm the subdirector for regulatory authorizations for medical devices to go into market. I work for the Ministry of Health for the agency called COFEPRIS. And right now, what I want to tell you a little bit is uh, how I've been doing a lot of the things that I right now have achieved. Being a clinical engineer has been wonderful for me. From the beginning, I started to work in a hospital. I strongly advise it to all the new students or the new biomedical engineers that want to get to know really what we do in our field is to work in a hospital. Right there, you can see all the things that we do, the impact that we have as a clinical engineer. Afterwards, I got to, by some means, all my life, I wanted to be a clinical engineer, but for some reasons in life, all the paths led me to be right now in regulatory affairs. And I got to see all the things that we lack as biomedical engineers to really get involved in this field. uh, we really get to have an understanding of all the regulatory standards of how we should do the things that must be done in our field, not just because they work good and we're saving lives and we make an impact on the health of patients, but also to try to make things better from the beginning. So right now, what I been looking at and doing most of the time is trying to see and help out all the new designers, new developers in having their product really go into market. And right now, as the subdirector of authorizations, we see that a lot of new products get involved with biomedical engineers, clinical engineers, but they do not understand really what the international standards are, what are the needs for getting to really go to market internationally, not just in our place of origin, but really internationally. So one of the things that I want to recommend to all of us, is to really get to know our standards, our regulatory agencies. What do they need? And mostly, the most important, for us to do a post-market surveillance system. I got to be the in charge of that department here in Mexico when it was just starting the post-market surveillance standard. And what I see right now in authorizations is that we lack that part as biomedical engineers, as clinical engineers, get involved in reporting all the incidents and problems of the devices to the manufacturers and also to our regulatory agencies to really make an impact and have safe and security that all the products that are in the market are with staying in that line. So we sometimes we just focus in what it's medical equipment, what we usually know, but medical devices in general are also from a band-aid onto to the MRI or different procedures. And sometimes we don't see us involved in catheters, but we do. And it's important for us to have post-market surveillance systems. The quality and also it's really important systems that can review the quality of our products and get our personnel involved in that part. So in all the facets of the things that I've done, from post-market surveillance, from being in Ministry of Health, and also in the part of industry as a consultant, is I kind of have both views. And right now that helps me a lot to see what the industry needs to have their products go to market in the right time, with that, without the lack of waiting too much for us to respond as a Ministry of Health. And also the view of the Ministry of Health of what should be in the market and what it's really needed. So it's two different sides, but we complement each other, and that helps me at least a lot to try to work things out right now uh, in the work that I have, to make that understanding for the people that work with me, to understand the point of view of the industry, and also to for the industry to understand what we're trying to do uh, internationally, trying to work with a nomenclature for medical devices that would work for us, and to try to standardize all the criteria to help out with all the regulatory affairs that we do. So mainly what I'd like to share with you is we as biomedical engineers have a very broad spectrums of possibilities of work, not just sales or manufacturing or inventing or having a new product in the market, but the part of regulatory affairs is something that we can and should be getting involved in, and something that I've really liked over the time that I've been in this part. So I'm really happy to help out, and whichever it's needed eventually, to have to be here with you in all this path and share all the knowledge that I have. So thank you very much for this intervention, and glad to be a clinical engineer.